Today, the Black Impact Collaborative hosted a community conversation on COVID vaccines, clinical trials, and the need to build up trust in the African American community. Derek Francis heard from the doctors who took part, who say that while we've made progress as a nation, there's still more work to be done.
The event was moderated by Dr. Walter Brame, a well-known member of the Black Impact Collaborative and former director of the Grand Rapids Urban League.
It is crucial to share this information so that everyone is empowered to make confident, informed decisions.
Confidence that the forum explained is lacking in the African American community based on what has happened over the decades, like the Tuskegee Institute study on syphilis from the 1930s that ran for decades.
If you know anything about syphilis, it's a pretty damaging disease.
Many deaths were attributed to the Black community only receiving placebos back then.
Some of these patients went on to have lasting harm. They had chronic health problems.
There was the malaria research project during World War II that exposed some 441 prison inmates to the disease who were then given drugs with a high rate of complications. To the story of Henrietta Lacks, whose cancerous cells were harvested without her consent in the 1950s.
She never knew that her cells were taken and used for this, for this purpose. And she and her family never got any benefit from this.
The medical director of research at Spectrum Health explaining the need to get back trust if they're to have a proper representation of COVID vaccine trials.
And it's hard now to ask those same folk to trust, right? But it's important.
A chart from 2 years ago showing African Americans getting the flu vaccine at a 10% lower rate than white Americans.
This tells you the challenge we're going to face as COVID vaccines come out.
That was our Derek Francis reporting. As trials continue, the plan is to spread transparency and education throughout the community. It's important because, according to the collaborative, if African Americans had the same mortality rate from COVID as white Americans, some 20,000 to 30,000 African Americans would still be alive today.